So I'm Dr. Velavan and Department of Oral Maxillofacial Surgery. So what is cryosurgery? Cryosurgery is derived from the Greek word cryos, which means frost. So the application of low temperature above the freezing point on living tissues in a controlled manner, and it creates to induce irreversible changes or damage to the tissues. So moving on to history, James Arnott was the first to record the formal application of the controlled freezing to destroy tissues when used below minus 20 degrees Celsius. The first cryogen used was liquid nitrogen, and compressed carbon dioxide snow became the popular in 1940s. So, what are the indications of cryosurgery in oral maxillofacial? It has a very wide range of application in our oral maxillofacial surgery, like pre-manual lesions like leukoplakia, benign oral maxillofacial lesions, malignant soft tissue lesions of oral cavity, pharynx, face, and scalp, bone lesions, cryosurgery of the nerve, cryosurgery of the blood vessels, cryosurgery of the salivary glands, and even cryosurgical treatment of melanin pigmented gingiva has been used. So, moving on to the case, we had a case, 20-year-old female patient who was complaining of a small swelling on the upper lip. She was in a case where it was attempted for an considered to be mucosal, and an excision was done, and again there was a recurrence immediately after the next day. So it was we found out it could be an hemangioma of the upper lip, and so followed with this, you can see the lesion exactly sitting onto the lower lip, almost to the verminal border. She was very particular about the lesion because she was having very bad experience and a very bad appearance onto the lesion sitting onto the upper lip. So these was the measurements of the lesion, how much it was, almost less than 1 centimeter in size, both mesiodistal width and length into width. So moving on to the cryotherapy, what are the armamentarium we usually use for the cryotherapy is your nitrous oxide cylinder and nitrous oxide, along with the circuit which will be having enclosed circuit. We have an gun, a cryo gun, and also a cryo probe with the different probe tips. Usually, nitrous oxide is used at an Celsius of minus 89 degrees Celsius. So, what is the mechanism of action of cryotherapy? So, it has in three stages like rapid freezing, slow thawing, and repetition of the freezing process. So, here you can see an cryoprobe which has been applied directly onto the lesion. So, this is the direct method where we just make the probe to touch onto the lesion, and you can see a small ice ball formation around the lesion. So which is will be usually seen in the rapid freezing cases where you can see the ice ball formation around the lesion. So you can see here, you can easily appreciate the small ice ball formation. So which will lead to an central necrosis of the tissues surrounding by the other tissues getting back to normal within 5 weeks. So this is a slow thawing procedure. You can see a small the lesion which was previously sitting onto the lower lip has been freezed. A rapid freezing has been done onto the thing, and it is allowed to go for a slow thawing procedure. So what are the phases of cryosurgery? The phases of cryosurgery are heat transfer, cell injury, and the inflammation. So here you can see a small necrotic slough of thing which has been happening after third to fourth day of the application, and it is allowed to slough over the area and to be a scab will be formed onto the lesion. So this is the measurement of the lesion after the regression, both length into width. Cell injury. So it occurs during the thaw after the cell is frozen. Usually there is an Crystal formation do not form until minus 5 degrees Celsius to minus 10 degrees Celsius. Immediately after the cryotherapy, there are ice crystals which will be seen directly intra and extracellularly. So extracellular ices reduces the extracellular water and therefore and increases the solute concentration on osmolality. So what is the reason is there is a rapid shift of the fluid from the from intracellular to the extracellular, which will be causing you the disruption of the cell membrane. The intracellular damages mitochondria and also the endoplasmic reticulum. Rapid freezing and slow thawing maximize the tissue damage. Low temperature allows also ensures maximum damage by further concentrating of electrolytes intracellularly. So the last response to the cryotherapy is the inflammation, which is observed as erythema and edema. Inflammation usually responds to cell death and helps in local cell destruction. Cryotherapy causes the basement membrane separation, which may result in the blisters formations. So, what are the cellular changes which will happen after your cryotherapy has been applied onto the lesions? Usually, within the 15 minutes, crenation of the nuclei and mitochondrial swelling happens, and vacuolation in the cytoplasm and dilatation of the endoplasmic reticulum happens. Every hours, up to 4 hours, nuclear membrane remains intact. After by 6 hours, the nuclei are barely distinguishable. By 12 hours, the cell appears dead. It allows intracytoplasmic vacuolation and loss of the cell architecture. Within 24 hours, there is a complete cellular damage. Within 30 days, the normal architecture and function is achieved. So, these are the cellular changes that will happen after your rapid freezing and your cryoprobe has been applied onto the lesions. So this is a small pictorial thing shows how what the happens to the cells. Cells before treatment looks like this, and after the ice crystals begin to form inside the cell above 10 degrees Celsius, minus 10 degrees Celsius, and ice continues to form and destroy the cell structures. What happens is after the warming or the after the thawing procedure, the ice has melted and leaving only dead cells on the lesion. So this is the patient which is after the almost second or third week where you can see the scabs has been removed and almost the lesion has been regressed. Only an healing process is seen onto the upper lip region. So there is no amount of necrotic tissues also lying on that area because completely it has become reepithelialization has happened in that area and the scabs has been removed. So, what are the sequelae? Which are the steps to be for happening? Usually, irrespective of the type, size, and the time of freeze cycle, the healing is same and occurs by secondary intention. So, immediately following the application, there are hyperemia and swelling of the area in contact with the probe. So, you can see it is immediately after or the intraoperative photo showing you the swelling and the hyperemia on the patient. So into 3 to 4 days, there is a necrotic slough formation that peels off from the underlying surface. So this is a necrotic tissue. This has been that peels off from the underlying surface. So the reepitheliation takes due course of 4 to 5 weeks. This is the third week photographic showing you that almost the reepitheliation has started and is going almost in the ending procedure. During the course of the healing, minimal inflammation is evident, but patients generally complain of increase in pain between the first and the third week and subsides completely by the fifth week. So this is the patient after the fifth week. Almost the healing has happened. The swelling has gone off, and even she's giving a better smile. And also the patient's lip looks so good. Even the vermilion border has been intact and there is no left out scar in that area and also there is no vermilion tent or dent or tent has been happened in that area because he leaves out a non-scarred healing. So what are the methods of application of the cryopo? There are many methods to be applied and method techniques has been used. Dipstick method, open spray method, and the probe method. So probe method is the most commonest method where you have a direct contact of your probe over the lesion site, which is mostly followed in our maxillofacial surgery. So the open method is all the other techniques, how it direct spray, paintbrush spray, and spiral spray is we used, but we are not using that. So this is a small video showing you the probe directly applied over the lesions. This is a rapid freezing technique, and this is a closed technique where you just apply the probe directly over onto the lesion. So this is almost for kept for around 2 minutes. 1.5 to 2 minutes is the time for a rapid freezing, where you have. So, how you decide the margin size? Usually, the margin size are decided based upon the lesion's extent. So, benign, if it's going to be benign lesion, you can extend the little as 1 to 2 mm beyond the visible pathological border. Like in a condition of your leukoplakia or other things, you can use almost to 2 to 3 mm. So, the margins will be almost the normal tissues also will be involved onto 2 to 3 mm beyond the margin of the lesion. If it's going to be malignant lesion, requires margins of 5 millimeters clinically normal skin to ensure the adequate removal of the malignant lesions. So usually in malignant lesions, it is always advisable only to for the surface lesions, and then if the depth is there or it is going to be infiltrating, you cannot use your cryotherapy because that is not a treatment plan for your malignant lesions, which has been infiltrating. Closed system. So there's a three types of closed systems which will be usually used for your cryotherapy. One is thermoelectric, evaporative, and Joule Thomson. Where the thermoelectric and the evaporative has been proved is not be going to have a better delivery of the system. So Joule Thomson effect is always the best technique which you use for the closed system. So Joule Thomson effect is a thing where you use an where the high pressured gas is passed through a low pressure area where it provides an rapid cooling in that area. So that is usually happens in your Joule Thomson effect, which will be providing you the rapid expansion, fall in temperature, and also the ice ball formation. So usually the cryogens which we use for the maxillofacial surgery is always a nitrous oxide, which will be giving you minus 89 degrees Celsius. So this is a small video showing out the thawing procedure. After the application of the rapid freezing, you can see a reversing back of the tissue with the during the thawing procedure. So this is a condition where the crystallization of the intracellular and the extracellular cells happen. And after the cooling or the warming effect, what happens is your cells are left out to be dead in that area. And this is almost followed for around 3 to 5 minutes, where your rapid freezing is for 2 minutes and your thawing is usually given for 3 to 4 minutes. And next cycle starts immediately where you will repeat the same rapid freezing uh, will be suddenly when you are going for a immediate and the common thing. Where you have a immediate and less common is headache and syncope. Delayed and rare is the post-operative infections, hemorrhage from the wound site, and also the pyogenic granuloma. So you can see some thawing procedure. After the thawing, you can see a blisters and also a small amount of edema seen around the lesion site where you have given the third cycle. This is the third cycle where we have applied the freezing, rapid freezing, and you can see some blisters and also some conditions of your edema around the tissues, which is usually common during the intraoperative of your cryotherapy. Complications like there can be chance of hypopigmentation, ectropy, and notching of the eyelids can be seen. Notching and atrophy of tumors overlaying the cartilage can be stenting or notching of the vermilion border of the lower upper lip can be seen. Atrophy, alopecia, and also nerve conduction can also be affected by telepathy, which is been now used as an advantage against your management of trigeminal neuralgia. This is another case which will be used for a marginal hemangioma like thing which is seen on the left lower, I mean on the left side of your tongue, and we are yet to get the post-operative photos of the patient actually. So, on to the conclusion, cryosurgery is a very safe, easy to perform, and relatively inexpensive technique, which can be mostly seen, it can be used in our clinics, where if you have an closed system of nitrous oxide and also you have an probe on the gun in your hands, you can use in all the lesions of the maxillofacial region, and it forms an atraumatic form because it doesn't leave any scar when you compare it with your conventional surgical method where you have to incise the thing and also you have to remove the tissues which will be having with healing by a scar in that area. So hope you had an idea about